is I'm going to show you my butt. I have some of these muscles back here which connect over our sit bones together so that the top part of the pelvis opens up. Then in the center here, we right above our this way. Hello and welcome back to my channel. If this is your first time here, my name is Sydney. I'm a perinatal athletic therapist and postnatal fitness specialist. On this channel, we talk all things perinatal, whether that be preconception, conception, pregnancy, postpartum, 50 years postpartum. We talk health and wellness, all that good stuff. So if any of that is of interest to you, please subscribe and stick around for a while. Today we're going to talk about all things pelvis and hip mobility. So I brought my trusty pelvis model to help me today, and I am hoping that I can explain everything well enough for you guys. If there's anything I say that isn't clear or that you want some clarification on, just write it in the comments below. I will get to it at some point, whether that be in a video or just responding to your comments. So this video is going to be greatly about the way that the rotation of our hips can actually affect the way that our pelvis is moving. And I'm going to kind of relate that back to positions that you can use during pregnancy or labor and delivery that may be of comfort or that may be helpful, specifically in the labor and delivery process. I think before we start, we need to kind of go through a bit of pelvic and hip anatomy first so that you guys can kind of understand how the hip relates to the pelvis and how they kind of work together and have those relationships together. Especially because I feel like so many people don't really know A, what their pelvic floor looks like, and B, kind of how the muscles from the hips and the pelvis relate to each other. Okay, I just needed to turn a light on because I just didn't think it was bright enough. So this is what your pelvis looks like. This is the front of your pelvis, as if you're looking at someone from the front. Let's start with just the bones of the pelvis. So we have two separate bones here. You can see they're connected in the center. These two bones actually move independently of each other, and they actually kind of glide back and forth like this while we move and while we walk. That gliding back and forth, if you don't have proper stability across this joint here, that's typically where we get that symphysis pubis dysfunction or that SPD pain that people talk about. So one pelvis bone is this entire thing here. This is the socket for that ball and socket hip joint. So your femur sits inside of that hip joint right there, and then the femur kind of comes straight down this way. So then we have another pelvis bone on this side. They're called the innominate bones. I'm just going to call them pelvis bones for the sake of this video. So two separate bones here that make up the sides and front of the pelvis. Then in the back we have our sacrum. Our sacrum is this triangle bone. It sits in between. We have our sacrum, and then we have our coccyx, which is our tailbone. It's attached to the bottom of the sacrum. And on top of the sacrum, we have our lumbar spine. So this is L5 and L4. Now you can see there's this space inside the pelvis. What is in here? All of our organs. If you're pregnant, this is where baby sits. This is where our bladder, which is underneath the uterus, our uterus, and then our colon is. So you can actually see how pretty crowded the organs are in there. And there's a lot of other tissues that are in there as well, kind of connecting the organs together, connecting the organs to the pelvis, making sure everything stays in its proper place. So there's actually a lot more going on here than what it looks like, but that kind of gives you a good idea sort of what the inside of the pelvis looks like. I'm actually just going to take the organs right out. I'm not going to go through the specific names of every muscle because I feel like we just need kind of an overall view of the anatomy. So I'm going to very much just sort of glaze over the general look and function of the muscles. And we're going to start by looking at the pelvis from the inside down, and then I'll show you the bottom up. So inside the pelvis, we have our sacrum and our coccyx, and we have all of these muscles inside. So from an internal perspective, you can see that we have all these muscles inside that hold up the organs of our pelvis. Now, what I also want you to notice here is how many of these organs connect to multiple different bones in the pelvis. So we have some of these muscles back here, which connect over to the pelvic bones on the side. So from the coccyx to the pelvis bone. Then we have these guys on the side that come from our pelvis bone and into kind of the center, which we would often refer to as the pelvic diaphragm. From an internal perspective, when these muscles activate, they actually lift up. So those are the muscles that are going to lift and hold up our pelvic organs. So that's just the inside. Now we're going to take a look at the outside. Then from an external perspective, and yes, this is a female model, we have these ligaments here that are called the sacrotuberous ligaments. They connect the pelvis bone on the bottom up to the sacrum, and then they actually continue up into the low back and then down into the hamstrings. Then in the center here, we have our anus, our vagina, and our urethra. And these openings all have muscles that allow control, that are connecting them to the pelvic floor, that are allowing for different functions to happen. Now, what you can't see in this model is that we actually have some muscles of the pelvis that connect directly into the hip bone. So our femur sits inside that socket. Some of these muscles, like these hip rotators here, we have a couple that come from the back. They all come and connect into the hip. So indirectly, by rotating the hip in different directions, we can actually affect the tension that's placed onto some of these muscles in the pelvis. And lastly, I just want to explain sort of the amount of muscles that actually connect into the pelvis that we don't necessarily recognize. Our abdominal muscles connect into the front of our pelvis here. We have hip flexors that come up this way. We have hip rotators that sort of connect on these sides of the hip. Our glute muscles that come up the back here, our paraspinals, our hamstrings. There's really so many connections to the pelvis that we sometimes don't even recognize. So I'll insert a couple pictures here of just sort of what those muscles look like on the front and the back, the deep and the superficial muscles, just so you can kind of understand how many muscles there really are acting on the way that our pelvis moves. Now, what we also don't see on this model is the nerves and the blood vessels that we have in the pelvis as well. The nerves that are shown in the low back here actually continue. This spinal cord continues down through this pathway here, and then each of these holes is a space for a nerve to exit as well. Now, each of these nerves has somewhere that it needs to go. Some of them go into the legs, some of them go over into the pelvis, some of them go into the pelvic organs. So I hope that kind of gives you a pretty decent overview of sort of what the pelvis and the pelvic floor looks like. Like I said, I'm not really going to go through the specific muscles and actions of all those muscles and those kinds of things. I just mainly want you to understand a general overview of kind of what things look like and how things function. All right, how's everybody doing? Is everybody doing okay? Now I want to talk a little bit about how the hips and the pelvis are directly related to each other and how movement of the hips or pelvis can actually affect one or the other. The difference between the pelvic inlet and the pelvic outlet. You may have heard these words when people talk about labor delivery prep or just exercises and things like that. So imagine there's a baby sitting inside the pelvis here. This is the pelvic inlet. This is where the baby starts to enter the pelvis. Then this space here between these pelvic bones is the pelvic outlet. We have different movements that we can do of our hips to allow for an opening of either the inlet or the outlet. So I'm going to show you both of those now. The other thing that's super important to understand when we talk about rotation of the pelvis and movement of the hips is hip internal and external rotation. This can be a little bit difficult to understand. So I'm going to actually use, normally I would use like some chalk or something like that and I would draw on my pants, but I don't have that. So I'm just gonna put some stickers on instead. The easiest way to think about internal and external rotation of our hips is to think about which way is your femur or your thigh facing. So I'm gonna put stickers on the front of my thigh. Okay, so now I hope these are big enough. Maybe I need bigger stickers. I'll see that. So these are the fronts of my thigh. So now I'm gonna grab a stool and I'm gonna show you something. So like I said, this can be a little bit confusing, so that's why I'm showing it to you this way. So the front of my thighs are facing straight up, which means that I'm in neutral. Now, if I put my foot outwards, you would think, oh, that's external rotation, right? But now my thigh and my femur has actually rolled inwards. It started in neutral. As I moved my foot outwards, my thigh rolled inwards. That means this is hip internal rotation because I rotated inwards. Then if I were to move my foot in this way, my thigh rotated outwards, which means that's external rotation. So I hope that makes sense a little bit. I'm just gonna keep these stickers on my thighs while we go through the video because I wanna make sure that you guys understand that. When we open up the pelvic inlet, the top part of our pelvis, we use external rotation. That's when the femur or the front of our thigh rotates out this way, which typically means that's when our foot comes in. So for the beginning stages of labor or while you are pregnant and waiting for baby to enter the pelvis, doing all kinds of rotation that allows the pelvic inlet to open up are going to be super important. So these would be movements of external rotation in the hips. There's a couple different techniques that I'm going to show you, and most of them are actually birthing positions, which is one of my favorite things, is to kind of combine those together. I should also mention it's great to do both internal and external rotation throughout pregnancy. It's actually fantastic to do internal rotation as well because a lot of us don't have as much internal as we have external. But I'm just referring to the beginning stages of labor specifically, or getting baby to kind of descend through the pelvic inlet. Okay, I hope I'm not losing any of you guys. I'm trying to be as thorough in explaining this as possible and give you guys some different ways to sort of envision what's going on. Now, all of the positions I'm going to show you, you should be able to do with an epidural as long as you have the right support from your birthing team. Many people think you have to be flat on your back when you have an epidural, which is not necessarily true. As long as you feel comfortable, you have the right support, and you are able to get into a position where you feel supported, you can go into any position you'd like to while you have an epidural. Especially the ones I'm going to show you where you're on your hands and knees, where you're leaning up against the end of the bed or the side of the bed, or if you're in a supported deep squat position, these are perfectly safe to do while you have an epidural. Let's say you are in the beginning stages of your labor and you want some positions that's going to kind of help baby travel through the pelvic inlet. This means we want to bring our sit bones together so that the top part of the pelvis opens up. This means we want hip external rotation. There are many different positions we can get into that allow for hip external rotation, which is, for most of us, is actually more comfortable than internal rotation. One of my favorite ways to do this is with a really deep squat. You always want to do this in a supported position because this can be a birthing position. It can allow you to just kind of relax here in this position a little bit more. This allows my femurs, or the top of my thighs, to rotate outwards. Now you can do this holding onto your countertop at home too. And one thing that I love to do here is I like to just kind of sway back and forth. That allows for a little bit more hip mobility as well. That position might be a little bit hard for some people to get into, depending on what your hip mobility or knee stability, if you have any knee problems, anything like that, that might be a hard position to get into. So another position that we can do is actually a kneeling position. And this is a really great position to do on the edge of a bed or in the hospital, on the hospital bed, all those kinds of things. So in a supported position this way, we want to rotate our femurs outwards, which means we want our feet to come inwards this way. So we're going to spread the knees wide. We're going to bring our feet together And you can just rock back and forth this way. Now this should be fairly comfortable for most people. If we do internal rotation in this position, which opens up the pelvic outlet or the bottom part of the pelvis, and we put our knees together and open the legs this way, this is fairly uncomfortable. Most of us have a lot of tightness in the hips when we go into internal rotation. This brings the inside of the femurs inwards, right? It rolls the thighs inwards. But this allows for opening of the pelvic outlet or the bottom part of the pelvis. Another way we can think about the rotation of our hips in relation to our pelvis is thinking not about our femur, but about our sit bones on the bottom. So I'm gonna see if this works. I've never done this on a video before, but I'm going to put these stickers on my sit bones, on my pants in the back, and I'm going to see if that sort of shows rotation of my sit bones from the back. Okay, so what I'm going to do is I'm going to show you my butt. You guys are just gonna be looking at my butt. I'm gonna be rotating my hips inwards and outwards, and you're gonna watch those 2 dots on my butt and see how they move outwards and inwards to open up different parts of the pelvis. So this is in neutral. If I rotate my legs outwards, which is actually internal rotation of my hips, you can see that the pelvis, you can see that my sit bones actually move apart. Then, as I rotate my feet inwards, you can see that the pelvis bones move together, or my sit bones move together. Actually a cat-cow exercise. So I'll show you both the pelvic inlet and the pelvic outlet opening here. So I'm going to show you the cat-cow from the back and also the side so you know what I'm talking about. This one is on all fours. This one's on all fours like this. So as we rotate our pelvis under this way, our sit bones actually come together, which opens up the top of the pelvis or the pelvic inlet. Then as we rotate under, we open the pelvic outlet and close up the pelvic inlet a little bit more. You don't have to actually have any rotation of the femur here. You're still gonna get some of that rotation. Now I'll show you from the back. So I'm gonna go into cat, which brings my sit bones together, and cow, which allows them to spread out. Cat brings them together, that opens up the pelvic inlet, and cow, which opens up that pelvic outlet. Typically, hospitals will have what's called a peanut ball. That's essentially those 2 stability balls that are attached in the middle, so it kind of has this wave-like look to it. If you guys know, I'll put a picture here instead of trying to explain what a peanut ball is. Most hospitals will have those. If they don't, you may want to talk to your OBGYN or your midwives or whoever is on your birth team. See if they have one of those. If they don't, you may want to pick one up for yourself. So with each of these positions that I do, I will include a picture of what it looks like using a peanut ball. But the goal is to just explain to you kind of how to open different areas of the pelvis utilizing the peanut ball. So this one's in a sideline position. And I'm doing it this way so you can see the stickers on the front of my legs. So this is in neutral. Now, if I wanted to open my pelvic inlet, we want to do external rotation, which means we want to allow the hips to open up this way. The easiest way we can do that is utilizing that ball or a pillow in between our knees, allowing our feet to come together. And you can see now my femurs or my thighs have rotated outwards. This is much less of an exercise as it is a position that may be of comfort to you. If you'd like to, in this position, you can also actively open up the hips this way in kind of a clamshell sort of way. Now, if we wanted to open up the pelvic outlet, we want to go into internal rotation, which means we want the knees to be closer together and the feet to be further apart. So we're going to move the pillow, ball, bolster, whatever it is that you're using. We're gonna put it down at our feet, which then allows the knees to come in towards each other, and this opens up the pelvic outlet a little bit better. Now in this position, again, you can just stay in this position as a position of comfort, or you can actually rotate the foot upwards this way, which allows for a little bit more internal rotation. So this is a little bit more of a typical laboring position that you would see. Now, in that regular laboring position that we see where you kind of have the knees out to the side and the feet a little bit more towards the inside, that brings our legs into external rotation, which opens up the pelvic inlet. Now we can do this position with internal rotation of the femurs or the thigh bones, which may be more helpful when it comes to pushing. So what we can actually do is just bring the knees a little closer together and allow the feet to go outwards just a little bit. And that will bring the knees into internal rotation, opening up the lower part or the outlet of the pelvis. Now, do you remember when we did the cat-cow exercise? And as we rotated our pelvis under into cow, it actually allowed for a better opening of the pelvic outlet. So what we can do here is we can add a pillow or a bolster underneath our pelvis. I'll just use this pillow that I have here. We can put this right above our pelvic outlet. And we can go back into that same position with the knees together and the feet apart, and that actually opens up that pelvic outlet even better. I hope this video was of good information for you and that you can start to utilize some of these positions during your pregnancy and into your labor and delivery. If you have any questions or concerns, please feel free to leave them below. I will either respond in a comment, I may make a video depending on what the questions are, but please feel free to ask any questions or gain some clarification on anything that wasn't clear for you. If you found this video to be informational or helpful in any way, please give it a thumbs up. And like I said, subscribe if you'd like to stick around and stay a while and learn about some of the things that I talk about on my page.